Please join me in welcoming Dr. Blaber.
Thank you. Good afternoon. First, I'd like to express my gratitude to President Hushmand, Provost Lohman, Deans Byrne and Radigan for their incredibly gracious invitation for me to speak to you on such a momentous day. I'm really very humbled by the invitation and experience. I'm also really excited to speak to you today. That is until I realized how incredibly eclectic this group of graduates are. I mean, you are biomedical engineers and scientists, molecular biologists, neuroscientists and histopathologists, anatomists, exercise physiologists, athletic trainers, nutritionists, public health and wellness graduates, registered nurses and advanced practice nurses, and if I didn't include any one of you, I truly apologize. At first glance, finding a common thread which I could talk to all of you about your chosen disciplines seemed like a daunting challenge. But then I came to the realization that all of you, one way or another, whether you know it or not, will dedicate your lives to the service of others. This is the essence of the Virtua College of Medicine and Life Sciences. To illustrate this, I'd like to spend a moment talking to you about how the care of a patient with severe aortic stenosis has changed just in your short lifetime. In 2002, the year that many of you were born, a patient with a condition like aortic stenosis would require life-saving heart surgery, where we would literally saw open the chest, cut out the aortic valve, and sew a new valve into place. This person would spend a week in the ICU, 10 to 12 days in the hospital, and at least 4 to 6 weeks out of work. Fast forward to 2024. As you're entering the workforce, that same patient can now receive a heart valve without surgery via a catheter deployed from the groin, taking a mere 60 minutes, with the patient going home the next day having her sternum untouched. This incredible leap forward is a result of the advancements of every one of your chosen disciplines. Whether it be the exercise physiologist who helped determine the clinical significance of the valvular stenosis, the anatomist or histopathologist who studied the pathophysiology of the diseased valve, the molecular biologist who helped us to understand why the aorta tends to dilate and weaken with such a valve, the nutritionists whose science helped us to speed healing, and the public health experts who opened our eyes to the perils related to unmet social determinants of health, like food and housing insecurity. Critically, the design and manufacture of that new prosthetic valve was the product of the imagination and collaboration of biomedical engineers and scientists, exercise physiologists, nurses, physicians, and surgeons. Finally, and this cannot be overstated, the advances in technology must be matched by the evolution of care at the bedside. In that regard, the field of nursing has evolved to require intensive care unit nurses and advanced practice nurses to become true experts in physiology, cardiac hemodynamics, pharmacology, and even ventilator management, while also bringing empathy and compassion to the bedside, both which are powerful elixirs of healing in and of themselves. Yes, healthcare is a team sport, as innovation so frequently requires intense collaboration across many disciplines. Those whose shoulders you will be standing on have collaborated vigorously to change the face of medicine in just a few decades. Think about how coronary stents, robotic surgery, artificial joints, and proton therapy, just to name a few innovations, have positively impacted the lives of so many of your loved ones, many of whom may be here today. So in the decades ahead, I ask of you, what role will you play in solving today's challenges and shaping the care of tomorrow? In that regard, I urge all of you to be bold. Don't let the fear of failure keep you from taking risks. The key is to simply fail fast, learn, and move on. Be authentic to yourself and your values. This is critical to your own happiness and inner peace. Be empathetic. A willingness to walk in the shoes of others will provide you with invaluable insights into their stresses and challenges. You will find that this is the cornerstone of creative problem solving. And last, be open to the ideas of others. That doesn't mean that you must agree with those ideas. It just means that you're willing to seek understanding through dialogue. So I've come to the conclusion that, yes, this is very appropriate that all of you are graduating together today from the Virtua College. You've all been well prepared, albeit in different ways and different curricula, to take care of those in need. That is the thread that connects you. And if you will indulge me, one last pearl of wisdom. And this might not resonate with you today, but hopefully it will at some time in the future. I submit to you that your life's success won't be defined by how much money you make, but by the lives you touch with your work, be it invention, service, or simply caring. For a life filled with purpose and passion is a life well lived and a life worth living. Congratulations to all of you. Thank you for listening, and good luck.